Medical Assistant Exam Questions and Answers 2026. Question 1. For a patient encounter in an infection control audit, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Shout from another room. Option B. Assume the patient cannot participate. Option C. Face the patient and speak clearly at a moderate pace. Option D. Cover the mouth while speaking. The correct answer is option C. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Shouting from a distance reduces clarity and privacy. Hearing difficulty does not mean the patient cannot understand or decide. Covering the mouth removes visual cues. Question 2. At the start of care in an urgent care office, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Quality control testing. Option B. Breach of confidentiality. Option C. Routine scheduling. Option D. Appropriate marketing. The correct answer is option B. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 3. During a pediatric clinic, a student asks which blood component helps with clotting. Which answer is correct? Option A. Plasma glucose. Option B. Neurons. Option C. Alveoli. Option D. Platelets. The correct answer is option D. Platelets. Platelets help form clots and support hemostasis. Glucose is a blood sugar and does not form clots. Neurons transmit nerve signals and are not blood clotting cells. Alveoli are lung structures involved in gas exchange. Question 4. To protect safety in a medication administration visit, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Follow office policy and patient communication preferences. Option B. Text any diagnosis to any phone number in the chart. Option C. Post the reminder on social media. Option D. Ignore all reminder preferences. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Preferences help guide appropriate communication. Question 5. Given the workflow in a phlebotomy station, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Appointment reminder template. Option B. Safety data sheet. Option C. Patient intake form. Option D. Insurance remittance advice. The correct answer is option B. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. An intake form does not provide chemical safety instructions. Remittance advice explains payment decisions, not chemical hazards. Question 6. During a patient education session, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Follow manufacturer instructions and quality control policy. Option B. Skip controls because waived means unregulated. Option C. Report results before the test develops. Option D. Use expired kits if the package is unopened. The correct answer is option A. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Question 7. During a primary care office, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Matrix blocking. Option B. Prior authorization. Option C. Wave scheduling. Option D. Stream scheduling. The correct answer is option C. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Matrix blocking reserves time unavailable for patient appointments. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Question 8. During a clinical skills review, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A, reverse isolation for staff protection only. Option B, contact precautions only. Option C, droplet precautions only. Option D, airborne precautions. The correct answer is option D, airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Question 9. To protect safety in a specialty referral visit, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The blood pressure may read falsely low. Option B. The blood pressure may read falsely high. Option C. The temperature will be elevated. Option D. The pulse oximetry reading will be inaccurate. The correct answer is option B. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Cuff size does not directly determine oxygen saturation accuracy. Question 10. Given the workflow in a family practice clinic, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. The patient should skip follow-up if pain increases. Option B. Body weight should rest mainly on the armpits. Option C. Crutches should fit properly and not press into the axilla. Option D. Crutches should be used only on wet floors. The correct answer is option C. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk. Question 11. While working in a women's health clinic, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Sterilization log. Option B. Progress note. Option C. Advance directive. Option D. Explanation of benefits. The correct answer is option D. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A sterilization log tracks instrument processing, not claim payment. A progress note documents clinical care, not insurance payment decisions. An advance directive communicates future care wishes, not payment information. Question 12. Given the workflow in a preventive care visit, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Gray fluoride tube for all serum tests. Option B. Light blue citrate tube for serum. Option C. Red or gold serum tube. Option D. Lavender EDTA tube for serum. The correct answer is option C. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. EDTA prevents clotting and produces whole blood or plasma, not serum. Question 13. The care team in a phlebotomy station asks for guidance because a pain score is being collected during intake. Which approach is best? Option A. Change the score to match the assistant's opinion. Option B. Assume pain level from facial expression only. Option C. Ask the patient to rate pain using the office's standard scale. Option D. Tell the patient pain is not part of vital signs. The correct answer is option C. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. The pain score should reflect the patient's report. Facial expression alone may not reflect the patient's reported pain. Pain assessment is commonly included in intake workflows. Question 14. To protect safety in a clinical skills review, A patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, offer water by mouth immediately. Option B, activate emergency response and assess breathing according to training. Option C, finish documenting the previous visit. Option D, move the patient to a chair before assessing. The correct answer is option B, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 15. For a patient encounter in a women's health clinic, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 10 milliliters. Option B, 1 milliliter. Option C, 0.5 milliliter. Option D, 5 milliliters. The correct answer is option C, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. 5 milliliters would provide 500 milligrams at this concentration. Question 16. After reviewing the situation in a community health clinic, a mask becomes wet during patient care. Which action is appropriate? Option A, replace the mask according to infection control practice. Option B, dry it on the clean supply shelf. Option C, keep wearing it for the rest of the week. Option D, share it with a coworker. The correct answer is option A, replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Used masks can contaminate clean areas. Extended use of a wet mask is not appropriate. Masks are not shared between staff. Question 17. Before the visit continues in an outpatient laboratory, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, double booking. Option B, wave scheduling. Option C, clustering. Option D, open hours. The correct answer is option A, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Question 18. A medical assistant is working in a community health clinic when the term tachypnea appears on an intake form. Which meaning is correct? Option A, painful urination. Option B, rapid breathing. Option C, slow pulse. Option D, low temperature. The correct answer is option B, rapid breathing. Tachy means fast, and nea relates to breathing. Painful urination is dysuria. Slow pulse is bradycardia. Low temperature is hypothermia. Question 19. An office review in a women's health clinic shows that a patient says they cannot afford a prescribed medication. Which response is best? Option A, tell the patient to stop all medications. Option B, suggest sharing medication with a friend. Option C, notify the provider or appropriate staff so alternatives can be discussed. Option D, ignore the comment because finances are private. The correct answer is option C, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. Sharing prescriptions is unsafe and inappropriate. The concern directly affects care and should be addressed respectfully. Question 20. A medical assistant is working in a cardiology practice when a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, random sample from an old urinal. Option B, first drops of urine into an unclean container. Option C, clean catch midstream specimen. Option D, specimen collected from the toilet bowl. The correct answer is option C, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Question 21. Given the workflow in a busy front office, A patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, tilt the head far backward. Option B, pack the nose with contaminated gauze. Option C, lie flat immediately without assessment. Option D, sit upright and lean slightly forward. The correct answer is option D, sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 22. In a primary care office, a claim requires the code that explains why a service was performed. Which code set is used? Option A, ICD-10-CM. Option B, NDC only. Option C, CPT. Option D, place of service only. The correct answer is option A, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. Question 23. The care team in a pediatric clinic asks for guidance because the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, oxygen saturation and pain score. Option B, blood pressure and temperature. Option C, pulse and respirations. Option D, height and weight. The correct answer is option D, height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 24. The care team in a family practice clinic asks for guidance because a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, beneficence. Option B, coinsurance. Option C, abandonment. Option D, assault. The correct answer is option C, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Question 25. For a patient encounter in a preventive care visit, a patient makes a complaint about care received in the office. Which response is most professional? Option A, listen respectfully and follow the office complaint process. Option B, post the complaint online for staff opinions. Option C, delete documentation related to the complaint. Option D, argue until the patient stops complaining. The correct answer is option A, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Arguing escalates conflict and is unprofessional. Question 26. When a patient encounter unfolds in a busy front office, a prothrombin time test is ordered. Which tube should be selected? Option A, lavender tube. Option B, light blue tube. Option C, gray tube. Option D, a blood culture bottle only. The correct answer is option B, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Lavender EDTA is used for hematology and can interfere with coagulation testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 27. At the start of care in a patient intake station, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, place electrodes over clothing. Option B, prepare the skin according to protocol to improve electrode contact. Option C, wet the electrodes with tap water only. Option D, ignore loose electrodes if the tracing prints. The correct answer is option B, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Loose electrodes can create artifact and poor quality results. Question 28. When a patient encounter unfolds in an internal medicine office, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Verify the recipient fax number before sending. Option B. Send it to a number from memory without checking. Option C. Leave the fax confirmation on a public counter. Option D. Include unrelated patient charts in the same fax. The correct answer is option A. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Memory errors can lead to misdirected protected information. Confirmation pages may contain protected information and should be handled securely. Only necessary information should be disclosed. Question 29. Following office protocol in a certification exam scenario, an electronic record uses an audit trail. What is its purpose? Option A. Sterilize instruments automatically. Option B. Track who accessed or changed information. Option C. Measure blood pressure. Option D. Approve insurance claims instantly. The correct answer is option B. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Question 30. In a medical office workflow, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Promise that the provider will not be concerned. Option B. Tell the patient the reading is probably wrong. Option C. Ignore the anxiety to avoid making it worse. Option D. Acknowledge the concern and explain the procedure in simple terms. The correct answer is option D. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 31. As part of exam preparation in an urgent care office, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Stomach. Option C. Kidney. Option D. Liver. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Question 32. As part of exam preparation in a pediatric clinic, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Delete the original note completely. Option B. Ask a coworker to change it under their login. Option C. Ignore the error even if it affects care. Option D. Make an addendum according to office policy. The correct answer is option D. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Deleting a signed record can destroy the audit trail. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Question 33. When a patient encounter unfolds in a patient intake station, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Reach across the field with unsterile clothing. Option B. Open sterile supplies without touching the inner sterile surface. Option C. Place sterile gauze on an unclean counter. Option D. Reuse sterile gloves from a previous patient. The correct answer is option B. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Question 34. The care team in a pediatric clinic asks for guidance because the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Use the appointment time as the identifier. Option B. Correct the date of birth without asking anyone. Option C. Stop and resolve the discrepancy before proceeding with care. Option D. Continue if the last name matches. The correct answer is option C. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. A last name alone does not rule out an identity error. Question 35. In an outpatient laboratory, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A, kidney filtration. Option B, ventricular depolarization. Option C, ventricular repolarization. Option D, atrial depolarization. The correct answer is option D, atrial depolarization. The P wave represents electrical activation of the atria. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Ventricular repolarization is represented by the T wave. Question 36. A medical assistant is working in an infection control audit when a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, wipe the surface dry immediately. Option C, dilute the solution more to reduce odor. Option D, use the disinfectant only on clean hands. The correct answer is option A, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Question 37. At the start of care in a busy front office, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, copayment. Option B, premium. Option C, deductible. Option D, adjustment. The correct answer is option A, copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. An adjustment changes the billed amount based on contracts or corrections. Question 38. After reviewing the situation in a phlebotomy station, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, centrifuge. Option B, otoscope. Option C, ophthalmoscope. Option D, reflex hammer. The correct answer is option C, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. Question 39. Following office protocol in an urgent care office, an intradermal test is being prepared. Which description matches the route? Option A, injection into deep muscle tissue. Option B, medication swallowed by mouth. Option C, injection just under the epidermis to form a small wheal. Option D, medication placed into the ear canal. The correct answer is option C, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Ear canal administration is otic. Question 40. At the start of care in an internal medicine office, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, appendix. Option B, gallbladder. Option C, urinary bladder. Option D, thyroid gland. The correct answer is option D, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. Question 41. At the start of care in an exam room, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, delete the form and tell no one. Option B, ask the patient to sign a blank form. Option C, report and correct the filing error according to policy. Option D, leave it because both patients use the same clinic. The correct answer is option C, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Question 42. For a patient encounter in an urgent care office, a provider orders spirometry in the office. Which patient action is required? Option A. Follow instructions for a strong, complete breathing maneuver. Option B. Remove the mouthpiece before starting. Option C. Hold both nostrils and refuse to exhale. Option D. Talk continuously during the maneuver. The correct answer is option A. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Talking interferes with airflow measurement. Question 43. As part of exam preparation in a specialty referral visit, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Sterile technique. Option B. Patient confidentiality. Option C. Prior authorization. Option D. Chain of custody. The correct answer is option B. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Prior authorization concerns payer approval for services. Chain of custody concerns specimen handling documentation, not public conversations. Question 44. As part of exam preparation in a diagnostic testing area, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Removal. Option B. Inflammation. Option C. Study of. Option D. Pain. The correct answer is option B. Inflammation. The suffix itis generally means inflammation. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Pain is commonly indicated by the suffix algia. Question 45. When a patient encounter unfolds in a quality control review, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Order of draw. Option B. Matrix blocking. Option C. Sterile field setup. Option D. Coinsurance posting. The correct answer is option B. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Order of draw guides blood collection sequence. Sterile field setup supports clinical procedures, not schedule blocking. Coinsurance posting relates to patient financial responsibility. Question 46. At the start of care in a treatment room, a peak flow test is ordered. Which body system is being assessed? Option A. Respiratory system. Option B. Urinary system. Option C. Skeletal system only. Option D. Integumentary system. The correct answer is option A. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 47. During an infection control audit, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. A properly grounded machine with still patient. Option B. A normal calibration mark only. Option C. Correct limb lead placement. Option D. Poor electrode contact or patient movement. The correct answer is option D. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Good grounding and stillness reduce electrical or motion artifact. Calibration marks do not explain baseline movement during tracing. Correct placement should reduce rather than create artifact. Question 48. During a pediatric clinic, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Complete all paperwork before telling anyone. Option B. Tell the patient it is probably anxiety. Option C. Notify the provider immediately and follow emergency protocol. Option D. Ask the patient to drive to another clinic. The correct answer is option C. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Potential cardiac symptoms should be handled through established emergency procedures. Question 49. The care team in a patient education session asks for guidance because the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Maintain required temperature storage and check expiration before use. Option B. Store it in a desk drawer overnight. Option C. Place it in direct sunlight to warm quickly. Option D. Use it after expiration if it looks clear. The correct answer is option A. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Question 50. Given the workflow in a family practice clinic, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Tuning fork only. Option B. Suture removal scissors or sterile scissors according to policy. Option C. Peak flow meter only. Option D. Ophthalmoscope only. The correct answer is option B. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. An ophthalmoscope is used to examine the eye, not remove sutures. Question 51. Before the visit continues in a specialty referral visit, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Refer the question to the provider. Option B. Tell the patient to stop immediately. Option C. Recommend doubling the dose instead. Option D. Suggest using a friend's medication. The correct answer is option A. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Directing medication discontinuation is outside the assistant role. Changing a dose without provider order is unsafe and outside scope. Sharing medication is unsafe and inappropriate. Question 52. Given the workflow in an infection control audit, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Clarify the order before proceeding. Option B. Ignore the medication order completely without communication. Option C. Interpret the abbreviation however it seems most likely. Option D. Ask another patient what the abbreviation means. The correct answer is option A. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 53. A medical assistant is working in a telephone triage workflow when a tickler file is used in the office. Which purpose does it serve? Option A. Draw blood into tubes. Option B. Track future follow-ups or reminders. Option C. Sterilize instruments. Option D. Measure oxygen saturation. The correct answer is option B. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Blood collection uses phlebotomy supplies, not a reminder file. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Question 54. While working in a pediatric clinic, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Produce bile. Option B. Filter lymph. Option C. Transport oxygen. Option D. Create antibodies as their main role. The correct answer is option C. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Bile is produced by the liver and stored in the gallbladder. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Question 55. The care team in a diagnostic testing area asks for guidance because a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Ask the patient to sign a form and give it anyway. Option B. Administer the medication because it was ordered. Option C. Change the medication to another drug independently. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. A form does not make an unsafe medication appropriate. An order does not override a possible allergy. Medical assistants do not independently substitute medications. Question 56. A medical assistant is working in a same-day appointment when the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Discard the tracing to avoid alarming the patient. Option B. Diagnose the rhythm for the patient. Option C. Change the tracing to make it look normal. Option D. Give the tracing to the provider promptly according to protocol. The correct answer is option D. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Medical assistants should not provide a cardiac diagnosis. Altering medical records is unethical and unsafe. Question 57. When a patient encounter unfolds in a patient intake station, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Place the tube in direct sunlight to warm it. Option B. Shake the specimen vigorously for 1 minute. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Leave the specimen uncovered at the front desk. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Question 58. A medical assistant is working in a medication administration visit when the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. Immediately. Option B. As needed. Option C. By mouth. Option D. Every morning. The correct answer is option B. As needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Question 59. During a certification exam scenario, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A. Discard the first void and collect all urine for the next 24 hours. Option B. Collect urine only when symptoms occur. Option C. Keep only the first void and discard the rest. Option D. Leave the container unrefrigerated unless it smells unusual. The correct answer is option A. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Question 60. A medical assistant is working in an exam room when a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Reprocess the instruments before use. Option C. Open the package and rinse the instruments. Option D. Write a new date on the package. The correct answer is option B. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 61. Given the workflow in a patient intake station, a complete blood count is ordered. Which tube is most commonly used? Option A. Lavender tube with EDTA. Option B. Red tube with no anticoagulant. Option C. Light blue tube with sodium citrate. Option D. Gray tube with fluoride oxalate. The correct answer is option A. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 62. At the start of care in a telephone triage workflow, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A. Nothing by mouth. Option B. New patient only. Option C. Normal pulse output. Option D. Nasal passage open. The correct answer is option A. Nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. NPO is not a nasal assessment abbreviation. Question 63. In an urgent care office, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Light blue sodium citrate tube. Option B. Green heparin tube. Option C. Gray fluoride oxalate tube. Option D. Lavender EDTA tube. The correct answer is option A. Light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Gray tubes are generally collected near the end of the order. EDTA tubes are collected later because the additive can contaminate other tubes. Question 64. During an internal medicine office, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Puncture through visible dirt. Option B. Clean and dry the puncture site according to protocol. Option C. Skip patient identification because the test is quick. Option D. Use the first visibly dirty drop for every test. The correct answer is option B. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Site contaminants can affect the first drop depending on protocol. Question 65. After reviewing the situation in a diagnostic testing area, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Open the door to air out the room only. Option B. Change only the paper on the exam table. Option C. Spray disinfectant and wipe it off immediately every time. Option D. Clean and disinfect touched surfaces according to office protocol. The correct answer is option D. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Question 66. To protect safety in a procedure setup, the term dermatology appears in a referral. Which specialty is involved? Option A. Blood. Option B. Heart. Option C. Skin. Option D. Kidney. The correct answer is option C. Skin. Dermatology is the specialty focused on skin conditions. Hematology focuses on blood and blood disorders. Cardiology focuses on the heart. Nephrology focuses on the kidneys. Question 67. After reviewing the situation in a women's health clinic, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Reaching across the sterile field with an unsterile sleeve. Option B. Opening the wrapper away from the body first. Option C. Using sterile forceps for sterile supplies. Option D. Keeping sterile items above waist level. The correct answer is option A. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Question 68. While working in a primary care office, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Against. Option B. Before. Option C. Below normal or deficient. Option D. Above normal. The correct answer is option C, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Before is indicated by pre. Above normal is indicated by hyper. Question 69. During an exam room, the term cardiology appears in a referral. Which specialty is involved? Option A, digestive disorders. Option B, heart and cardiovascular system. Option C, skin disorders. Option D, kidney disorders. The correct answer is option B, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Question 70. At the start of care in a medication administration visit, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, patient reports sharp right ear pain for 2 days. Option B, ear infection diagnosed today. Option C, right ear normal after exam. Option D, patient seems dramatic about ear pain. The correct answer is option A, patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Exam findings belong to the provider and are not the chief complaint. Subjective judgment is unprofessional and not appropriate for the medical record. Question 71. The care team in a same-day appointment asks for guidance because the term hypertension appears in the problem list. Which meaning is correct? Option A, high blood pressure. Option B, joint inflammation. Option C, slow breathing. Option D, low blood glucose. The correct answer is option A, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Joint inflammation is arthritis. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Question 72. When a patient encounter unfolds in a patient education session, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, PERLA. Option C, HIPAA. Option D, ARICE. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 73. An office review in an internal medicine office shows that the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, ear inflammation. Option B, painful or difficult urination. Option C, excessive thirst. Option D, difficulty swallowing. The correct answer is option B, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Question 74. To protect safety in an urgent care office, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, skip explanations because the patient signed in. Option B, leave the patient uncovered until the provider arrives. Option C, discuss the patient's body in the hallway. Option D, provide appropriate draping and expose only the area being examined. The correct answer is option D, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Question 75. To protect safety in a procedure setup, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, auscultation. Option B, autoclaving. Option C, venipuncture. Option D, prior authorization or referral process. The correct answer is option D, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Question 76. In a telephone triage workflow, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Ask the patient to jump to the table. Option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Option C. Leave the wheelchair unlocked for easier movement. Option D. Pull the patient by the arms quickly. The correct answer is option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 77. The care team in a walk-in clinic asks for guidance because a specimen label is missing after collection. Which action is best? Option A. Ask another patient if the tube belongs to them. Option B. Follow facility policy for recollection or correction without guessing. Option C. Write a name on the tube from memory. Option D. Send the tube with no label and explain later. The correct answer is option B. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Laboratories commonly reject unlabeled specimens. Question 78. During a preventive care visit, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Vena cava. Option B. Pulmonary vein. Option C. Aorta. Option D. Carotid vein. The correct answer is option C. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 79. Following office protocol in a diagnostic testing area, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Snellen chart. Option B. Tourniquet. Option C. Hemostat. Option D. Autoclave tape. The correct answer is option A. Snellen chart. A Snellen chart is used to screen distance visual acuity. A tourniquet helps locate veins for blood collection. A hemostat clamps tissue or small objects during procedures. Autoclave tape indicates exposure to sterilization conditions. Question 80. Following office protocol in an exam room, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. Zip code. Option B. ICD-10-CM. Option C. CPT. Option D. Policy number. The correct answer is option C. CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. Question 81. Following office protocol in an outpatient laboratory, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Document that the patient was difficult and continue. Option B. Tell the patient that questions are not allowed. Option C. Give the medication quickly before the patient refuses. Option D. Pause administration and verify the order and medication. The correct answer is option D. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Labeling the patient does not resolve the possible medication issue. Patients should be encouraged to participate in safety. Rushing increases risk and ignores a safety concern. Question 82. Given the workflow in a same-day appointment, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Improved privacy protection. Option B. Loss of accountability for chart access. Option C. Better sterilization monitoring. Option D. Automatic insurance approval. The correct answer is option B. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Question 83. For a patient encounter in a specialty referral visit, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, gray tube. Option B, green tube. Option C, lavender tube. Option D, light blue tube. The correct answer is option B, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Question 84. An office review in a preventive care visit shows that a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, record the measurements using the unit required by the office protocol. Option C, record height only because weight changes often. Option D, round weight to the nearest 10 pounds. The correct answer is option B, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Both height and weight may be needed for clinical assessment. Large rounding errors can create unsafe dose calculations. Question 85. To protect safety in an infection control audit, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, diagnose the patient based on abnormal values. Option B, post the result publicly so others can comment. Option C, tell the patient the provider will review and explain the results. Option D, change the results so it appears normal. The correct answer is option C, tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Diagnosis is outside the medical assistant scope of practice. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Question 86. When a patient encounter unfolds in a treatment room, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, patient autonomy. Option B, respondeat superior. Option C, abandonment. Option D, beneficence. The correct answer is option A, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Question 87. As part of exam preparation in a patient education session, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, copayment. Option B, coinsurance. Option C, remittance address. Option D, referral. The correct answer is option B, coinsurance. Coinsurance is the patient's percentage share of covered costs. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. A referral is permission or direction to see another provider. Question 88. Following office protocol in a diagnostic testing area, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, ask the patient to breathe as deeply as possible. Option B, count respirations while the patient is unaware of the measurement. Option C, record the respiratory rate from the last visit. Option D, count for 5 seconds and multiply by 12. The correct answer is option B, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Deep breathing changes the normal respiratory rate and effort. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Question 89. A medical assistant is working in a family practice clinic when the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A, kidney. Option B, gallbladder. Option C, appendix. Option D, spleen. The correct answer is option A, kidney. The kidneys filter blood, regulate fluid balance, and form urine. The gallbladder stores bile and does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. The spleen filters blood cells and supports immune function but does not form urine. Question 90. For a patient encounter in a telephone triage workflow, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Finish all remaining patients before telling anyone. Option B. Place a bandage on the site and ignore it. Option C. Wash the area and report the exposure according to protocol. Option D. Hide the incident if there is no bleeding. The correct answer is option C. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 91. While working in a cardiology practice, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Give instructions as quickly as possible. Option B. Use medical jargon to sound professional. Option C. Ask only whether the patient has any questions. Option D. Ask the patient to explain the instructions back in their own words. The correct answer is option D. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Patients may say no even when they misunderstand instructions. Question 92. A medical assistant is working in a family practice clinic when lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. 5th intercostal space at the left midclavicular line. Option B. 4th intercostal space at the right sternal border. Option C. Left arm below the clavicle. Option D. A 4th intercostal space at the left sternal border. The correct answer is option B. 4th intercostal space at the right sternal border. V1 belongs at the 4th intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. Question 93. Following office protocol in a preventive care visit, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Wait until a patient reports slipping. Option B. Place a warning sign and arrange cleanup immediately. Option C. Cover it with loose papers. Option D. Ignore it because it is not in an exam room. The correct answer is option B. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Question 94. A medical assistant is working in a patient education session when lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Midway between V2 and V4. Option B. 4th intercostal space at the left sternal border. Option C. 4th intercostal space at the right sternal border. Option D. 5th intercostal space at the left midclavicular line. The correct answer is option D. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V2. That location is used for V1. Question 95. Before the visit continues in a preventive care visit, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A. Count the pulse for a full 60 seconds. Option B. Count for 10 seconds and multiply by 6. Option C. Skip the pulse and record not available. Option D. Use the patient's previous pulse from the chart. The correct answer is option A. Count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Question 96. As part of exam preparation in a treatment room, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, tell the patient fasting means no restrictions at all. Option B, cancel the test because diabetes always prevents fasting labs. Option C, tell the patient to stop all diabetes medications without provider input. Option D, review fasting instructions and route medication questions to the provider. The correct answer is option D. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Fasting usually includes specific limits on food and drink. Diabetes requires careful instructions but does not automatically cancel testing. Medication changes can be unsafe without provider direction. Question 97. A medical assistant is working in a treatment room when a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, tighten it further until the vein bulges. Option C, release it and allow the arm to recover before continuing. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option C, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 98. A medical assistant is working in an administrative check-in area when coordination of benefits is needed. Which situation does this usually involve? Option A. A patient needs a sterile dressing. Option B. A patient has one cash payment only. Option C. A provider orders a throat swab. Option D. A patient has more than one insurance plan. The correct answer is option D. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. A throat swab order does not itself involve multiple insurance plans. Question 99. At the start of care in a patient intake station, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, use gloves and dispose of the dressing according to biohazard policy. Option B, save the dressing in the patient's purse. Option C, handle the dressing with bare hands. Option D, place the dressing on the clean supply tray. The correct answer is option A. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Biohazard waste should not be sent home in personal belongings. Bare hand contact increases exposure risk. Soiled material can contaminate clean supplies. Question 100. A medical assistant is working in an administrative check-in area when a patient feels faint during a blood draw. Which response should occur first? Option A, stop the procedure and protect the patient from injury. Option B, leave the patient alone to find paperwork. Option C, tell the patient to stand up quickly. Option D, finish filling the tube before responding. The correct answer is option A. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Standing can worsen faintness and lead to a fall. Continuing the draw can worsen the situation and increase injury risk.